Hi everyone, welcome to Lecture 9. In this lecture, we're going to talk about family considerations when we're thinking about individuals with disabilities. And it's really important to consider the whole family unit when we're talking about an individual with an intellectual or developmental disability. And we'll talk about some of those reasons why and some of those additional considerations that we'll want to make. Of particular importance, I want you guys, hopefully you have watched this lecture and read the material from the Gerstein article before you watch Autism the Musical, because I really think it will help you get a lot more out of those families and those families' relationships with their children that have a disability. And a lot of those children, most of them don't necessarily have an intellectual disability, but rather all of them have an autism spectrum disorder. And in the lecture after this, we'll talk about the difference between those things. But I think this is a really important lens to kind of watch that documentary through, and that's why I have you guys watch it, because I really like you guys to examine the family relationships and the stresses and the successes and the joys that having a child with a developmental disability has, and just some important considerations for us. So why do we need to consider the family? So when we're looking at families of people with intellectual disability, we know that about 85% of non-institutionalized adults, so those individuals not living in any type of institution or group home, they live with their family. So individuals with intellectual disabilities specifically live with their families for much longer than the general population. Only about 7% of adults with intellectual disability are married and living with a spouse. However, it should be noted that the divorce rates of people with intellectual disability are not different from the general population. Later in Module 3, we're going to watch another documentary about a couple with Down syndrome that live together and are married. But again, that's usually the exception rather than the rule. So it's really important to look at individuals with intellectual disability or a developmental disability and their family through a family systems theory kind of lens. And so family systems theory recognizes that there's a series of complex interactions that mediate how a family will respond to disability and having a family member with a disability. And the first thing to consider are family characteristics. And these are things from the size, so is it a small or a large family? The structure, where do people live? Is it a single parent home or more than one parent? How many siblings are there? Additionally, the culture. Culture is really, really important. Different cultures view disabilities differently and may embrace or not embrace certain parts of disability in different ways. So it's really important to understand how culture plays a part in a family that has a member that with a developmental disability, and socioeconomic status. So is it a family in poverty, a family in consistent poverty or transitory poverty, a family of low, middle, high SES? This is important, again, I think, when you watch the documentary, and it's certainly a limitation of the documentary in that the majority of the families, you can tell, come from high socioeconomic status. They come from their families of means. And so I want you to think about that when you're watching the documentary too. Recognize that it certainly is a limitation of the documentary, just giving one point of view. But even still looking at the stresses and joys that come maybe as a product of their socioeconomic status, how might there be additional stresses or joys if they were from a different socioeconomic status or culture or structure of their family or size. Member characteristics play an important role in understanding how a family responds to having an individual with a disability in their family. And this can just be basic personality, their overall health, if they have another family member that has a disability, so more than one. And then it's important to look at each member's responses to the disability. How do they think, feel, act about having a family member with a disability in their family? Then also some really specific challenges like poverty or loss of a family member. And then also making sure that you examine the interpersonal relations among each members. Do people get along or not get along? Do certain people get along better or worse with one another? And how do each of these things really play into those interpersonal relationships? So, when we look at family systems theory and the impact of disability, it's really important to examine the parental relationships. So in general, anecdotal information does indicate or suggest that having a child with intellectual disability adds stress to a marriage, both positive and negative stress. Some empirical evidence does indicate that there's increased divorce rates, but there's still more information is needed to draw conclusions on this. There's another theory that the needs of the child draw the parents together. They kind of have to band together to embrace and handle challenges associated with having a family member with a disability. You'll see both of these things happening in the documentary, Autism the Musical. It's important to kind of look at that. Some research indicates that two adult households do reduce caregiver stress. The child's characteristics may influence the marital stress, so depending on how severe or not severe the disability is. And additionally, if there's secondary health conditions maybe associated, excuse me, that can influence the amount of marital stress. And then the parents, their mental health affects the well-being of the child. So do the parents have difficulties maybe with anxiety or depression? Or does one of the family members or one of the parents also have a disability? This can impact the child's well-being in both positive and negative ways. Really want to stress here, though, that children with disabilities do not cause divorce. So while there's some suggestion that the rates are higher, I really don't want anyone to think that at all what I'm saying or what the research is suggesting is that having a child with a disability causes divorce. All right, so looking again through family systems theory and the impact of disability. So the adaptive capability of the family, how well they're able to adapt to having a child with a disability, really depends on two main variables. And the first one is the general health and well-being prior to any adverse circumstances. So how healthy of a family, mentally, physically, financially, are they prior to having this child with an intellectual disability or a disability? And then additionally, the extent to which the family perceives the situation as adverse. Does the family perceive this as a horrible, adverse situation that they have to come over or overcome rather? Or is it something that the family perceives as maybe just a bump in the road and they want to move forward with it? It's not necessarily like one is bad or not bad. And I'm certainly, again, not saying that if parents do perceive the situation as adverse, that's bad news bears for the family and that they're not good parents. But it does tell us how well the family kind of can handle challenges associated with having a child with a disability. So this is some information from some research. So we're looking at parenting stress. Many studies have demonstrated that parents of a child with intellectual disability are likely to experience higher rate of parenting stress than parents with children without disabilities. A few studies have found that parenting stress is associated with the severity of the child's intellectual disability, but this hasn't been able to be replicated. So it's suggested that the more severe the intellectual disability, the greater the parenting stress. Generally, it doesn't seem that specific characteristics associated with intellectual disability are important correlates to parental stress. We do know that communication skills, I misspoke. So it does seem that specific characteristics. So what I was, and these two specific characteristics are communication skills. So how well is the child able to communicate? Do they have verbal language? Do they have a nonverbal communication system? Is the child able to communicate effectively with their parents? And do the parents have a way to effectively communicate with their child with a disability? And then the level of behavioral difficulties. So does the child also have some comorbid maybe difficulties with aggression or self-injurious behavior? This can really impact parental stress as well if the child has additional behavioral difficulties outside of having an intellectual disability. When we're looking at parenting stress, there's been little evidence between the child's level of skills, specifically adaptive behavior, and parenting stress in mothers. There is clear evidence of an association between child behavior difficulties and parenting stress, like I just mentioned. Um, these next pieces have to really do with support, which really can be helpful. So parents with greater levels of social support, and that doesn't necessarily have to be from family members, but any type of support group or friend, experience these parents that have more social support experience lower levels of parenting stress. Also important to note that it's the amount that the help is perceived as being helpful, not necessarily the amount of help. So just being there or having a sounding board for a mother can be really helpful for decreasing her level of stress. Mothers with higher levels of parenting self-esteem, so how confident they feel in their parenting abilities and able to handle the situation and the unique needs that may go along with having a child with an intellectual disability. These parents that have the higher self-esteem and more confidence experience overall lower parenting stress. And mothers with a more internal locus of control, of parenting control, tended to experience lower levels of parenting stress. And what this means is that if the parents felt like they had more control over their parenting and what they were able to do, this allowed the parents, mothers specifically, to experience less stress. And we're looking at our locus of control, again, a locus of control. That's our ability to feel like, again, we have a sense of agency and can have control over our environment. So having that sense of internal, like, I can do this, I have the skills, I can make changes if I need to, I can get resources if I need to. This can be really helpful at lowering parenting stress. So when looking at the Gerstein article, there's a lot of great information in there, but just some points that I wanted to highlight. Resilience research suggests that having a supportive person in one's life is an important factor for resilience. So again, it doesn't necessarily have to be another parent, but just a supportive person to help them. That can really help with resilience and the ability to embrace having a child and really, deal with the challenges and see all the good and additional things that having a child with a disability can bring to the family. This really helps with resilience. Meta-analyses revealed that there is a small but significant decrease in marital satisfaction for couples that have a child with intellectual disability. Again, I really want to stress that this is not saying that having a child with a disability absolutely creates marital discord and divorce. Again, we know the rates are a little bit higher. There's some suggestion of that, and there's some suggestion that marital satisfaction overall decreases, but we just talked about a lot of protective factors that can also help with that as well. In general, greater marital quality, so how well both parents perceive the quality of their marriage, that can really also predict lower parenting stress. And this is even after controlling for socioeconomic status, severity of the intellectual disability, and overall social support. So again, the quality of the marriage and the ability for parents to kind of be able to work together and feel like they have a strong foundation, this can also predict lower parenting stress. When we're looking at positive parent-child relationship, so a positive parent-child relationship has been consistently associated with positive outcomes for both children with and without disabilities. So it's really important that the parent-child relationship is also examined, how well the parents and the children are able to get along, understand each other, have opportunities connect. This can really help long-term with having positive outcomes. So this is part one. The second video, part two, we're going to talk a little more about sibling relationships and some other unique challenges and also successes and joys and lovely things about having a family member, and specifically a child with an intellectual disability. Thanks, guys.